Hi everyone, this is Aurelie Najm live from Vienna Conference Center. After 3 days of conference right now, I can confidently say that I have learned a lot as always. A couple of abstracts I want to discuss with you, and it comes down to the eternal question we ask ourselves in clinics, which is in PsA, after a first failure of a TNF inhibitor, what do you go for? Do you go for a different mechanism of action? Do you go for another TNF inhibitor? Eular and GRAPPA recommendation have not formally stated whether it should be one or the other. The first poster that's tried to answer that question is poster 0278. And so what it does is that it looks at a cohort of 400 plus PsA patients. That's where, and it's interesting, it's from the Netherlands, and they have this historical cohort where there was only TNF inhibitors available. So that was before IL-17. So obviously they had to kind of cycle, yeah. And then they have this other cohort of about of a few more patients that they did swap from TNF to IL-17, and they look at the 3 years retention rate as a surrogate for efficacy, as well as 1 year disease activity. So what they find, I found it quite interesting, is that when they do adjust for discontinuation reason, which I think is a very thing to adjust for, and a lot of other cohorts haven't done that, they don't see any difference in retention, which does make sense in some ways. And also they don't see any difference in that CRP in the two swapping versus cycling groups at 1 year. One thing they did see though is that when they separate groups between male and females, they saw that males actually that were cycling rather than swapping for a different mechanism of action did have a worse prognosis. In fact, they had an odds ratio of failure of the drug of 1.67, but this was not found in females, which in itself is also an interesting finding that requires further studies. And then the other poster was 0266, and this one finds somehow a different result. It was the BRAC cohort, 340 plus patients with PsA, a group that swapped, a group that cycled again, and then they did find a better outcome in people that were swapping, which is also interesting. But one thing to note there is that they did not adjust for reason for discontinuation. And I don't think, I mean, they don't describe having adjusted on a lot of data actually. So I would be a bit more wary about these data. But I think what we need actually is probably a trial so that we know exactly what to do. And I'd be interested to hear what you do in your practice. But for now, I will go and thank you for this, your attention on this, and follow me on Twitter at Aurelie Remo and follow Rum now.